I had heard through the grapevine that he had a bad hip.
You heard that I was limping all over New York?
No, it was through another mutual friend.
Yes, I've had 2 hip replacements, one in 2007, one in 2014. When I came to him the first time, I'd been hobbling around for months, denying reality.
One morning I went to start to see my patients, and the first name on my list was William Bradley. And I thought, could it be? So I knocked on the door and walked in the room, and I thought to myself, oh my God, it's him. And the last thing he said to me was, so what do you think? And I said, what do you mean, what do I think? He said, do you think I need a hip replacement? And I said, what, are you kidding? You can't walk. And he opens the door and he says, I can walk, watch me. And he walked down the hall again and came back.
I said, do you think I need a hip, a new hip? He said, well, yeah, about 6 months ago or a year ago, yeah. And then I remember when he removed the hip, he told me, some people, your hip is deteriorated 100%, yours is deteriorated 150%. So it was a godsend. And I never will forget the operating room. I go into the operating room, it's very cool. The nurse has incredible eyes, and Frank Sinatra is playing. And I think, hey, it's not going to be so bad.
As the senator says, there's no way I could do what I do without the people in the room. I had a visiting surgeon from London one day, and at the end of the day, we had done 4 or 5 hips in that room. He said to me, you didn't ask for anything from your scrub nurse. My scrub nurse is Stella. I said, I know, she's spooky. She knows exactly what I want. In fact, sometimes when I need something different, she knows from my body language what I want. So she saves 10 minutes of operating time. The circulating nurse saves another 10 or 15 minutes. The anesthesiologist saves another 10 or 15 minutes. They make sure my patients are safe. So I'm just a cog in a wheel. And our wheel works pretty well most of the time.
It's one of these great operations. You go in, you got tremendous pain. You come out, it's no longer there. Obviously, you got pain related to the incision and the operation and the need to rehab, but the original pain is not there at all. And it's one of the miracles of this particular surgery. And, it's also, as I said earlier, it's one of the miracles of having Dr. Pellicci do it. And as hospitals go, I put it right at the top because it's one of the few places where virtually everybody that goes there comes out happy. Whereas you go to another hospital, who knows, you might get some disease from being in the hospital, or there are people dying on the same ward. Doesn't happen at special surgery.